That is my actual license plate.
Nice. I like it.
Representing. All right. So, well, look, I know you guys are busy. We have a lot to get through. Art also mentioned that he is on the truck today.
Oh God, Art. Jeez.
So if at any point you need to go, we will Photoshop you back in. How about that?
Yeah. Let's hope I don't.
Sounds good. Well, why don't we start with this? So as they say where I grew up, action. Thank you guys all for being here. There is much to discuss on these topics, and I am actually really, really proud to have you three together. Jonathan Fights, Beyond Lucid Technologies. We're going to be doing this session for the Sacred Cows and Data Cubes podcast for GEMS, the Journal of EMS, so we'll leave a little ad for them in there. And I generally do these topics one-on-one, to be honest, when we have these. For Scott's benefit, I'm going to point out it's a video podcast or a vodcast. Clothes are required, but only from this point up. They can be painted, they can be part of the background. I care not. Yeah. So anyway, normally we do these. I do these types of discussions one-on-one, and I kind of let them go in any number of directions. But as I've had conversations with each of you, and I want to get into each of you introducing yourselves in a second. We've touched on areas ranging from education to post-traumatic stress to human resources, and the fact that education and post-traumatic stress bleed into human resources. The idea that data per se, whatever the source, can inform all of those things, especially now in the age of COVID. Knowing whether somebody has shown up, as Scott, I'll have you talk about in a minute, would talk about things like, have they had a vaccine? Are the people allowed to know whether they've had a vaccine? Do you want to know whether they've had a vaccine? When we get into questions of, is a pill just as good? And that's just on one front. Then we talk about taking that out of the 911 service and putting it into areas like health in the home. Moving the hospital into the home, community paramedicine, but also in a structured fashion. What I found is that there are some common threads that the three of you represent. And so Sean, being on the phone, I'll certainly try to point to you over cell phone since I can't see your expression. But the idea that these are overlapping topics. And one thing that everybody, hey, there he is. He's really here. No, be safe, man. Be safe. Without the camera is fine. You're on mute.
Mm-hmm.
Sorry about that. I am pulled over off to the side of the road in downtown Boston.
Okay. I'll say you could also be on Storrow Drive and it would look the same. You wouldn't be going anywhere. BU Pride. Anyway, so I think what I want to sort of set you guys to talk to each other about today, and I'm going to kind of curate a little bit, but I think when you go to a conference, like a AAA's conference, like an EMS World conference, like a HCA conference in Kansas City, where I'm going to be next week, talking about the use of data to identify sparks of post-traumatic stress as opposed to sparks of infection, like we've been talking about for the past 18 months or so, right? The idea that these topics get discussed in a bubble because you've got a bubble at the conference, right? You had to submit a talk. Here, you don't have to submit a talk. And the reality is these topics are overlapping, and you three are three of the smartest people. I did just realize we are all white men on this conference, so probably worth a discussion on that at some other point, but we'll let that sort of simmer here in the background, and at least we recognize it. And I think I kind of want you guys to take the respective angles and experiences that you have, and if you were going to talk to an interested audience that wanted to understand how education and law and policy and data and regulation and clinical practice blend together, right? Because in a daily practice, that's what they do. That's where I hope we'll go today. And so with that intro, if it's all right, I'm just going to kind of go counterclockwise. Scott, Art, Sean, is that the order it is on my screen here? Tell the world, the four people who don't already know you and your voice, who you are, And
Sure. So my name is Scott Moore. I'm a 31-year EMT, an 18-year employment attorney and HR consultant. I've previously run ambulance services of various sizes and composition, but as of the last 6 years, I've served, I've run my own consulting organization and law firm, as well as served as the American Ambulance Association's Human Resources and Operations consultant. So that, in a nutshell, still an EMT, stopped working on the truck about probably 18 months ago during COVID. And outside of that, though, I think due to age and all the other reasons why old guys stop working on ambulances, that's spending an awful lot of time over the last year talking about workforce.
And we got to mention Newton in there. I can put an ad in.
Oh, yeah. And in addition to that, right, I am the owner of really what is an employee engagement feedback tool called Newton 360 that I started a couple of years ago, have, a couple thousand folks on the platform. But just like, in all other things EMS right now, it is really hard to get supervisors and leaders to engage staff because everybody is busy doing calls and unfortunately won't be able to fix the problem until we stop the wheel from spinning enough so that folks can engage employees to sort of address some of those underlying causes that drive turnover and recruitment issues.
Well, I feel like that's something that I hope we'll talk about today.
Yeah.
Because at the end of the day, again, the ability to utilize things like data, right? This is a data-driven video podcast. But to identify that, I think one of the underlying mantras that I find myself saying more and more these days is, can you afford not to, ... whatever that is. And so I think to the degree that, can we show the wheel how to stop spinning by emphasizing that if you did things correctly, as opposed to just doing things the way that you always have, it would actually serve dividends, not only now, but help you get where you're going. So I don't think, I know you sort of tack on Newton there as something that you've done, but I think it's actually potentially core to this conversation. It's something that I've thought about a lot lately is, can you know your people and what you would do if you did know that?
Well, and Jonathan, just to add to that, is one of the reasons why I don't often bring up Newton when we're in this context is because when folks know that you have an underlying, product that, an mobile application, oftentimes the message gets diluted because they think you sell the product. And then the reality is, actually, I've had folks who I've known and worked with at the AAA now for the past 6 years, one that I was just at the conference with, who sent me an email on the flight home that said, "Hey, I understand you have this supervisor efficiency mobile engagement tool for employees specifically designed for EMS." And I say, "Oh yeah, I do." But, again, as a consultant HR employment lawyer, frankly, that is what I have. That's what I consider my fiduciary obligation first. And then, the tool is something that I do believe will actually is part of the solution to the underlying problem, because no matter how much we want or need supervisors to go out and do calls, no one got into leadership to do calls. They got into leadership to coach and mentor. And yet the research and data suggests, and we only have it in retail, not in EMS, that the average frontline supervisor only coaches and mentors about 6% of the time. So you take EMS where they're all distributed, it's probably 2 to 3% of the time. And I think, frankly, that's the single biggest thing driving. In fact, our morale issues are with leadership more so than they are with staff. And that's what's driving a lot of the problems.
Well, let's come back to that, and we'll talk about, if I don't come back to myself, please bring us back to the topic of rotational training, because I hope we're going to solve that together here today for the first time in 12 years since I've been doing this. Speaking of riding the truck and mentoring, since Art, you are sort of on the clock, as it were, we have you on borrowed time. Introduce yourself, sir, Chief.
Geez, I feel like I'm the poster child for that last introduction. So my name is Art Groux. I have been managing services for almost 30 years. I've been a paramedic for 30 years this year. All different size services, from the from a large corporation service to a volunteer service, and to where I am today. And geez, so many things in that to talk about today. But I definitely think that workforce engagement has been it's definitely a problem. As I said, I'm on the truck today. So that goes to show you where our time is being spent at the moment. Not the most efficient use of time, certainly not of mine, but not of most of the leaders in the services, but that's where we find ourselves. And part of that is because we don't have good data to support what we do. And I'm sure we'll get into that a little bit more. But I'll keep my introduction short so we can keep moving.
Well, and while appreciated, that is actually, again, I didn't bring you guys together by accident. Let's be clear. And it wasn't just because I love seeing your respective faces. Now had the opportunity of seeing Sean's live and in person. He was one of the few people I've seen in the last 18 months. And Art, yours too. Not actually, I left Sean to go see Art 2 weeks ago. So saw you guys both within a 24-hour period. That was fun. Missed Scott by a few minutes, I understand. No, I think that these issues are interrelated. So complicated, yes. And if we need to have this conversation in a part 1 and part 2 and part 3, by the way, I, for one, have no fear of doing that. Hopefully you guys will come back for more. Can't keep you all day here. With that, Sean, take it away. Yeah.
So it's interesting hearing you guys talk about the interrelationships between staffing and whatnot, and I'm looking forward to getting into some of that. I'm Sean Kukauskas. I'm the Director of Ambulance Services for the Spaulding Rehab Network and the Director of Spaulding Hospital Ambulance Service. Career paramedic, been in EMS close to 30 years, been in administration for about 10, ran the road for many, many years. Finally made the leap to administration about a decade ago. It's probably been one of the most challenging things I've ever encountered, is trying to manage a system, manage people, and trying to make sure that our team does what they need to do, has the tools they need to do, and even more so has the tools to function at home.
Say that last part again. You cut out for a second. Was that
have the tools to function at home, so they can do what they need to do and do what they need to do for us. It's definitely been a challenging year, and yeah.
Okay. Well, with that, thank you guys. Let's dig in. I'm like you said, I'm gonna fancy my role here as moderator more than interviewer per se, because I kind of want you guys to talk with one another. I'm doing this a little differently than I normally would do, but I almost want to do a free association of a couple words based on what each of you has said, even just now, and also what I hope you'll bring to this. And anyone who wants to take it away, if you don't do it yourself, I will point at you and unmute you, and then you're in the hot seat. Okay, stress, training, personal lives, data, and wages. I put that last one in there because apparently it is not a controversial issue. But I find, and I'll add a fifth one as kind of an overarching mess to that, is social media as the place where I love the meme that's gone around that I wish this pandemic would be over so all my epidemiology friends can go back to being economists. And before that, lawyers, of course, they're all lawyers too in their spare time. So to the degree that we know these are related, which spoke in the wheel should one address first? Who wants to go first? Stress, training, personal lives, data, wages. And I know those are kind of free associations. So I kind of want to throw that out there first and see where you go with it. What comes to mind? Yes.
If I can, one thing I will say, because Jonathan, you and I shared the data, position. I think, what is it? Anybody without data just has an opinion. And essentially one of the challenges that we've had, and I've spent the last 4 years with the American Ambulance Association trying to work on cost data collection, is that, over the last, really in the history of our very young profession, we have always struggled with data. And one of the reasons why our reimbursement levels are where they are because there is no systematic method of collecting data regarding costs and even some of the personnel metrics. One of the challenges that we've highlighted when working with the different federal groups is that, for example, that study, or I think the information we learned from the state of Texas, that something like 25% of their certified individuals submitted a trip record in any one 30-day period, which means that the majority of the folks who are certified are actually not working for EMS services. So, we don't right now have one really lead agency, number one. Number two, one central repository of data information, because before they had instruments to collect data on the weather, folks would just look up at the sky and you had very little time to respond to the pending weather situation. Now we're in this position where the gates have been down, the lights have been flashing relative to workforce for decades, but everybody's sort of surprised that the train came through the crossing. And I think, we need to systematically be collecting data in virtually every part of there are more data systems in EMS agencies than we know what to do with, but there's no one taking all that information, synthesizing the information, and using that information, either correlating it to other factors and or using it even in a predictive way, right? Because this is stuff that, again, gates have been down, lights have been flashing. So I don't know, I defer to the other guys what their thoughts are, but I think data is sort of the place that we have to start, because everything else will be either an educated or an uneducated guess, and more likely the latter.
Well, and I'm going to throw more wrenches at you in a minute. So go ahead.
So I'll agree that the data is an essential element. As Scott said, the amount of data we collect on just a single call is astronomical. Whether it's data we require for our own systems, it's data we require for NEMSIS or some other type of reporting system. The amount of data we collect is astronomical. What we do with that is a very different story. As administrators and leaders, we understand the need for data. We understand how to process it, how to utilize it, and how to make educated decisions based upon that data. What gets lost is getting it down to the boots on the ground, and how does the collection of data help relieve the stress of their job, especially in the post-COVID world. EMS systems across the country have. Let me back up a little bit. Healthcare across the country has lost their ability to flex and to compensate. And that has added a tremendous amount of stress to the system. We see it every day. I work for a very large healthcare organization, and we're in code capacity every single day because we can't get patients moved through the system. And as such, crews and systems coming into the acute care hospitals can't offload their patients. Which adds additional stress, because as leaders, we're saying, you got to move these patients, you got to clear up, but there's nothing that they can do about it, and the system seems to have stagnated since COVID. And when you talk to the boots on the ground, we talk about stress. They are getting absolutely beat to death because of workforce shortages, because of increased demand, because of just all of the lack of our ability to flex within healthcare and make the adjustments that we need to. We know that anecdotally, but it's difficult to show it with true data. And even more so in the system that do collect a lot of data, it's tough to get the general staff to understand how this impacts their role, and how, even when you talk about just performance improvement measures, how to not see it as something punitive, but to see it as something that's going to benefit them.
Art?
Yeah, so I'm kind of gonna go the other way. So I think that the data is important. Well, we know what to do with the data. In some aspects, I think some of us know what to do with the data, but the data that we're using is our data. And because the uniformity of the collection of data across services is not there, regardless of what, we may want to say that we all know how to collect response times. I'm not sure we're all collecting response times the same way. So is that, and that's just one example. So the data that we're collecting is our data. We know how to use it within our organization, but we don't know how to compare that across the industry because there's no standard in how we collect that or how we define it. Contrary to what I think some people may think that there is a standard. I don't really feel that there is, but I would say that and Sean mentioned this about talking about how our employees are absolutely getting hammered. I think that the place we need to start is and it can be from a data standpoint, but the wellness of our employees. Our employee base is getting hammered, but we can tell that a lot of times by the data if we actually had the data to compare across the industry. And I think that that's one of the problems we face. What is, and we can go back and look at number of calls that a crew member does. That really is not a significant number. It's time on task. That's a much more significant number. But also, what are our crews being exposed to on a daily basis, and how often, and how frequently? And are we tracking that? And are we talking to them? And are we having meaningful conversations with staff? I think that that's probably, kind of taking that data and pulling it back to the HR side as well. I guess I'm kind of on the fence there, Jonathan. I think both of them are important. I think they tie together in a significant way.
Well, like I said, I'm going to throw some wrenches in here in a second, but I did want to throw out while we're talking at the granular level about data, start thinking about the word evidence as opposed to data, because that's where I'm going with this. But as long as you and I have known each other years now, it's remarkable how time moves. You've always worked on the borders of states, right? So or at least close to, such that you may cross lines, right? So I find myself, the statement that you made there about we know how to work with our information, right? What do you find is a practical reality that, Sean, you mentioned NEMSIS, for example, and I, for one, am a big proponent of NEMSIS. I mean, a pain in their butt, and I'll continue to be. And I also think it's an extremely important part of the ecosystem that is very little understood in terms of the importance of standardization. And not just across EMS and mobile medicine in general, but across the healthcare ecosystem. We can talk about that if you want. But how have you found it affects people on the ground? Or when you, based in Vermont, cross into New York, for example, and find folks speaking a different language, or cross from Connecticut into Massachusetts, do the disjoints on the ground? I know here in California, that was an issue for years in the earlier part of my career in EMS, when reciprocity across county lines is a young thing here. So you would literally cross a county line and find that your protocol, which is totally fine where you are, could get you in serious trouble in another location. What do you find that does to the relationships among the clinicians on the ground in terms of not only their work inside the agency, but how you can liaise with others to have a communal response? Do you find that gets in the way? Do you find it's kind of an afterthought? Sort of, tell me a little bit about that. I think it's an interesting adjunct to your work in particular.
30 years ago, it was a much bigger issue because there were significant differences in standard of care. I started my career working at a border service where the standard of care in the state that we transported from was much higher than the state that we transported to. But we operated under the standard of care where we came from, not where we were going to. So that was a much bigger thing. That standard of care has become a little more consistent. Now it's more of a staffing and certification issue. When you cross the line from Vermont to New York, there's a difference. There's a difference when you cross from Massachusetts to Vermont. We'll use critical care level just as an example. If you're a Massachusetts-based service or if you're a New York-based service, you don't have to have a critical care certification to take a patient that's on a vent out of the state of New York and out of the state of Vermont and bring them to New York. However, if it's a Vermont licensed service doing that trip, that Vermont licensed service, the provider has to be licensed by the state at the critical care level. And that creates a little bit of a rub amongst staff from one service to the other because the standard is not the same based on what the license plate on the truck is. And it has nothing to do with the provider.
Talk to me then a little bit. Take this. We're gonna toss it back in the direction of you and Scott and the overlap there. But I know you and I have had some offline conversations around where, as you say, a rub among personnel clinically, but there's also an economic investment, right, that folks have to be willing to undertake. I had that conversation with a rural provider not far from you about the amount of basically the distance they'd have to go in order to go to school, to get a different level of service, to take better care of their community, but not often because it's a tiny little service in the middle of the hills. So there was this challenge that they felt, that the economics, the education, the licensure kind of rubbed against one another to say, if our mission is to take care of our community, are these other inputs affecting our ability to meet that mission, but in a way that, for example, without a unified front, there is everyone's sort of fighting that battle on their own. So talk to me, maybe Scott, and I'll punt that to you a little bit, but I think, and Art, if you want to chime in on, please feel free. But to the degree that you're talking about those differences, and when you look at, obviously there are lots of different colors of patches in this industry. That's the source, I believe, and I'll say on record, of a lot of trouble. Every agency, every person for themselves. It's something that the fire service does not have it does not have that drama behind it. It does locally. There's plenty of drama, the fire service. We all know this. But they, at the end of the day, you come at one of us, you come at all of us. EMS does not have that. I know that is a live wire issue. I don't shy away from such things in a podcast with sacred cows in its name. But talk to me about, when you start rubbing up against the question of unified voices. I won't use the big U word, but I do think it's how, without a unified voice, with the status quo of the industry as it is, where these issues of people getting churned out exist today, you can't build, the AFL-CIO was not built in a day, it took years, right? And lots of political chasms to build that sort of thing. So given the status quo where we are now in the midst of a pandemic and a paramedic shortage and everything else, Scott, which of the levers would you pull first? If you were going to design the system the way you, in all of your wisdom, would do, and again, I've got I'm going to go from here, but tell me what breaks the cycle, what hatches the chicken, et cetera.
Well, no, I think it's an interesting question, and I'll premise all my comments with the fact that I'm an employment-sided management attorney, right? I'm a management-sided employment attorney. Let me say that right way. So, I'm not looking at this per se in an organized labor sort of way, but what I do think is,
and I just throw that out, by the way, I just throw that out as an example of like,
no, I totally get it. And I think, we're seeing some of these challenges as we're looking at certification issues across different jurisdictions, and we're looking at issues related to even moving folks who formerly served in the military in a role really similar to EMS, and trying to get them over onto the certified roles in any particular state. And I think, again, this comes back to, that old saying that if you've seen one EMS system, you've seen one EMS system. And the reality is we all kind of put people on a stretcher the same ways. Yes, there may be some regional protocols, but truthfully, I don't really understand why there isn't sort of one, I understand the desire to control EMS at the local level, but I do not believe that we're in a time when we need to be creating barriers for people who want to move potentially from one location to another for whatever reason, to be able to, even during national responses, we should be at some sort of core level of, as Art said, terms and definitions where we're all really on the same page. Again, I think probably if we look back as to why there are all these independent little fiefdoms when it comes to certification and rules and regulations, some of it is geographical. In other words, what is happening based upon, I did a call in the middle of Missouri, 2 ALS trucks covering like 1,400 square miles, very different than doing a call in Revere, Massachusetts, where I have 4 trauma centers and 3, interventional cath labs within 4 minutes. So I get that part, but again, we don't need to create barriers for people to get into this field. And I think if we could, find a way to find those core things, make it easier for people to get into the industry. To your point, being 4, white, dare I say, middle-aged, sorry guys, guys sitting on a screen, oftentimes when you look at where some of these educational programs are, and the barrier to entry might be that there isn't public transportation to some of these places. There isn't childcare in the evenings when a lot of the EMT and paramedic courses are done. So, I don't know. I just think it is time, as you put it, for one sort of central oversight agency that, we don't even have that really in the federal government. So, I'll defer to Art on this one, but, I think that we need to be removing barriers, not erecting them.
So, Sean, let me turn to you. You run a bit of a unique service. And Boston is a pretty unique place, I think, when it comes to medicine in general. Not just the sheer compressed nature that Scott referred to, but you've got some big providers, you got a lot of small towns, you got a whole mess of history. You've got, amazing institutions, right? So, and ironically, by the way, as an aside,
Boston University, I'm just saying.
Yeah. I also studied across the river at MIT, so I can't be too much on that. So, but yeah, but it wasn't for nearly as long, and I don't actually know what their mascot is, so now they might pull back my certificate from there. Anyway, that's sad. It's Ivy League. Do they even have and then they have like a color? Their colors.
Oh, there's got to be a blazer or something you wear. That's what it's elbow patches and stuff.
It's too expensive for me anyway.
Yeah.
Sweaters.
Fair enough. So it's actually interesting to think about so much of the complexity of mobile medicine in the Boston area, because so much of the complexity of the health IT conversation also has its roots in the Boston area. Mickey Tripathi, who's now the national coordinator of health IT for the federal government, came out of that area. He ran the Mass, I believe it was the Mass eHealth Collaborative was the formal name. And Jonathan Bush, of course, founded Athena Health in your backyard, and Meditech is down near Rhode Island, the Attleboro area, I believe, near Foxborough or something like that. So there's a whole lot going on over there. And so I want to turn to you, Sean, with a question that I know is controversial. It should be controversial, but it's also very emblematic and I think endemic to the problem. What evidence do we have, if we have all of these data problems, and I've got a nifty little flow chart here that we'll come to that I wrote as you guys were talking about the relationships between data and statistics and getting to a better life for all the practitioners, so people want to be in this industry. I think there's a direct line that can be drawn. But if we have these problems, slicing and dicing metrics and comparing Armstrong Ambulance to Bennington Rescue Squad to Spaulding IFT transports, and not to say any of the fire services, the air transport services, community paramedicine agencies, right? I mean, there's all these different flavors that are in here. What is the evidence of the value of this industry? Right? What is the value of EMS? What is the proof that we have that we do a better job than other forms of intervention, aside from the fact that in some cases we might be faster? And mind you, obviously, I bleed purple, so like this is coming from me. But I think as a data guy, don't we have to ask this question? How can you answer the question if the data are so broken? Go ahead. As far as
and I think that is the key point, Jonathan, is how can we measure it when the data systems are so disparate and they don't either talk to one another, they don't speak the same language, we don't measure things the same way. And when you look at impact or cost savings, you also have to think about what do we consider a benefit? How do we consider a benefit? So do we consider, if you look at EMS, even looking at that, does EMS truly define who and what we are?
Yeah.
Yeah. But with that, it's tough to get aligned when mobile medicine, or whatever term we're using today, doesn't have a true identity. So it's tough to measure that impact when we don't have standardized definitions. We don't even really know who we are and what we're doing. You talk to one group and they'll absolutely tell you that IFT work, which is absolutely the bulk of what I do, has no impact on healthcare. But I can tell you that if my IFT service is not performing at the top of their game, the services that are providing direct EMS care are not going to be able to get out of that emergency room any faster. And now that's going to have direct patient impact. I think what we often tend to do, especially now, is we see a couple steps out of our own box. We are struggling to see beyond where we are, because we are so stressed, because we are so backed up. We're trying to figure out kind of in the now how to manage where we are. I don't know if we ever really had a good grasp on where we are and where we want to go. We've kind of trudged through it. But now where things seem to be kind of, almost falling apart at the seams in some instances, it's difficult to get everybody on the same page. Excuse me. To even get folks to have a couple of minutes to even talk about some of this stuff. It's a true challenge, and I don't know if we're ready to have those discussions. We see it on the hospital side, the individual fiefdoms, the difficulty in breaking down the barriers to even just sharing common practice, let alone sharing some, what could be business proprietary type of data. It's difficult for me to measure benchmarks against another ambulance service, because there's not another ambulance service out there that's like mine. I'm a rehab-based hospital service. There's not one out there in the United States. So how can I measure my benchmarks against another like service? It's extremely difficult.
Art, you came off of mute. I assume you want to chime in on that.
Yeah, no, I would agree that, everybody's stretched thin, and they, we're living in our own fiefdoms. I'm actually, to be honest with you, I'm kind of thinking that this is probably the best opportunity we've ever had to have that unified voice.
Oh.
Right now, that not the size of this conversation, but this is an excellent opportunity. But that the point that the system is in is actually as broken as it is, or as broken as it seems, and as stressed as it seems, is actually creating the perfect opportunity to have this conversation. Because when we look at, so I'm on the truck today, right? So that goes to show you that, we're living at a point where, the system is so stressed that all of these people are carrying out roles that they normally wouldn't be. It's not efficient for system delivery when you're pulling, people higher up in management onto the truck, because it's that stressed at the day. So now is the perfect opportunity. And I think that, as much as it's creating difficulties, it's creating an opportunity that we haven't seen, at least I haven't seen in 30 years, to start to look at how do we work together to have this conversation to make it a more unified system.
And I'll tell you, not for nothing, but I actually think, again, it's why I wanted to bring you guys together for this. I think this actually is a demonstration of that. You guys cross lines, even though in some ways we are the least diverse group in the history of anything. But in other ways, you actually do in a lot of ways. And I mean, Scott, kind of looking at you, want to hand to you. I mean, you particularly, you're like a bee out there, just pollinating conference to conference to conference all over the country, right? Spreading the wisdom, seeds of Scott.
Be careful about that in the COVID time period.
Yeah.
You ain't kidding. Masked and vaxxed and taxed and all, anything else that goes with that. So, I think let's turn to you on that. I'm saying, when you when you go between these groups, and I'll put a small plug in here for the Congress of Mobile Medical Professionals, which I know you've all participated in or heard of and whatnot as we've worked in the last 18 or so months to try to be a bigger tent. That was the entire concept, right? Be the biggest tent possible, because we needed to create a forum where folks could, quite frankly, tell each other they were wrong and not say, well, then I'm going to go start my own association. Okay. If you instead invite people to disagree, then, I think is that a legacy? You mentioned military, and I have a lot of draw to that, having been in Boston on September 11th when I walked myself to Government Center and enlisted in the United States Army Reserves. Turns out Tourette syndrome and the U.S. Army do not see eye to eye. For viewers out there, if my portion of the screen seems a little twitchy, it's not you, it's me, I promise. Scott, when you look at the history of mobile medicine, I'll still use that buzzword for now, coming out of the fire service, which in some countries is still a military function, and has huge connections here to a military history. There is a rank hierarchy and so on and so forth. Has the way that this industry grown put itself into a corner? And by the way, the U.S. military, of course, is also undergoing a reckoning on all kinds of fronts about free ability to communicate. And if you are not allowing, folks to express themselves in certain ways, do you end up with other stressors that keep people from enlisting? So to the degree that how much of the invitation to cross communicate, to tap into the concerns of the line crewmen, do our structures support that? Right? From a managerial perspective, do you think people feel able to say, for example, I don't want to get vaccinated? Let's use the most current topic that there is, right? I mean, that's drawing battle lines in New York City, in Los Angeles. Serious problem when you have a significant portion of your workforce not come in, and you don't, and then another portion of them are sick and taking care of kids at home, and so on and so forth. So have we gotten ourselves into that situation by a very structural issue? And if so, do we have to let it melt down?
Well, I want to make just a couple of comments. First, having just gotten back from the American Ambulance Association's annual conference, I attended a couple of meetings on the pre-conference meetings before the show started on Sunday. And in the room was the International Association of Firefighters, NAEMT, the National Registry folks, Dr. Kramer. It was the first time I can recall all of those groups getting together because of one sort of similar problem related to workforce. And so I have to give all of those groups a lot of credit for sort of laying down, to me, it never really all made sense because, I used to have a state inspector here in the state of Massachusetts when I'd say, how do you deal with that service? They always just do it really poorly. He goes, I love all God's children, right? Because basically there's room for everybody at the table. And so my thought had always been, I don't care what kind of EMS service that you deliver. I just care that you really aspire to deliver good EMS, no matter how it's delivered. And, was a call firefighter, although I know in many places they see call firefighters as potentially problematic because they take away from paid firefighters. But the reality is that a huge chunk of our country is covered by call fires and volunteer fire services. But so just to get out there that I think we have turned an unbelievable corner due to the need. This is sort of like, in Game of Thrones when everybody gets together to face the larger looming challenge. So just to say that, but I think, this is not, at least from my perspective on the workforce side, as I say, the problem can be solved, or the solution is simple, but it's not going to be easy. And again, when you ask sort of down at the field level, if 2 to 3% of our time is spent, and I say engaging in coaching and mentoring, what I really mean is in supporting field staff, right? And especially when Sean talks about how busy they are, the fact of the matter is I used to do a shift where I did 30 calls in 24 hours, but it was typically followed up with another shift in a day or two that was, just 1 or 2 calls. I don't think any services are really dealing with anymore. So people are getting run harder and heavier these days. But again, fundamentally, everybody goes to work, wants to make sure that they're doing good work. They're looking for feedback. They do need to be connected with. And if only 2 to 3% of the time they're receiving some sort of support from their underlying organization. And, I've said this, I don't know how many times now, when I hear leaders tell me that they have an open door policy, I call crap on that, because the purpose of the open door, you're telling them you have to make the effort to come to me. And what I say is open door policy means you might accidentally fall out of that office every so often. But when I look at what Art's having to do, right, if he's staffing a truck, how the heck is he supposed to do that? Well, it has to be intentional. Folks pay attention to what you measure. And unless you understand how often the team members in your organization are engaging, the team members in your leadership, and how often they're getting feedback and how often you're hearing stuff, frankly, you should be more worried about what they think about working at your organization than what you think about their performance, because the reality is those scales have tipped. And I don't care what you're paying those folks, they're in charge. You should know that for sure.
Art, obviously turning to you, that's going to be the natural segue there. But do you feel, and I've thought this about you for a while, because you've run the truck voluntarily because you're a glutton for punishment, in a variety of places. But do you consider that to be a superpower of yours? Because I would. I actually think it keeps you so close to your crews because you're in the suck with them. As opposed to being in the office. I wonder what would be your perspective. I mean, between what Scott threw out there, the need to understand what they're feeling, but at the same time, don't you feel it too when you're out there? What do you think?
You do, but I think that it depends if you're in the truck because it's a choice. So from a management standpoint, if I'm in the truck because it's a choice, that's different, and that's having that positive impact with your crews. If you're in the truck because you're short, that's a different situation, and I don't think that, I'm interacting with my partner on that shift, but I'm interacting with them in a different manner. Because I'm probably trying to get stuff done in the office at the same time that I'm trying to get stuff done in the truck. If it's a shift that I'm looking at down the road and saying, hey, you know what, I'm going to go ride the truck with this crew or these people next week, I'm planning my week around being able to devote that time to support them and talk to them and find out what's going on. But when it's, like today, I'm filling a call out today. So my day wasn't planned around being on the truck. My day was planned around doing some of the other stuff that I had to do within the organization. And so, to Scott's point of getting out there, that has to be, and I don't want to make it sound like it's not can't be a spur of the moment, but it has to be planned in the sense that you have to remove the other distractions if you're going to have that meaningful impact, conversation with your crews. And just riding the truck doesn't necessarily give you that meaningful interaction.
Okay, Sean, I want to turn to you with the same question, but I want to throw a little caveat on it, if I may. Are you able? It looks like you're moving. Are you able to answer a question?
Oh yeah, no, I'm parked on the side of the road.
Okay, sounds good. So when you and I sat down a couple weeks ago, which was really fun, by the way, one of the things that you said to me that hit incredibly hard, and I don't know that I've ever heard anybody say it to me this way. So I want to take the same question of the relationship that you have with your personnel and understanding, the pulse, but also the workforce. Is I asked you how you get things done at your organization, because you got a lot of masters around you. And your answer was extremely pointed. It was, I'm in senior leadership. It's a bit of a paraphrase, but it was something to that effect. And I thought it was such an interesting view to me because of this idea of that perspective suggests that you have worked yourself into a position where you can make influential decisions, and you can be, but again, you're not the guy. You're a member of senior leadership, right? You are one of many in a very complex organization, but it suggested to me that you breathe that advocacy role. And tell me if I don't think I'm misreading that from everything we've talked about. You have this education role with AAAs, right? And so clearly these topics are important to you. So do you think that, how do you think taking on the role as advocate, as go-between, as representative of that crew, that agency to your many constituents, so how do you live that? And how do you think it balances with the reality of being a service that's so short-staffed, for example, that may be a luxury? That seems like a pretty, again, as you talk about kind of splitting the seams a little bit, but it seems like those are some pretty heavily integrated roles in a job that if they come apart, they don't really work naturally in separate silos as they do when you are pulse and manager and mentor and advocate. You are clearly living that internally. To talk to me about how you reconcile that, or how someone not in your position could do so.
So it's interesting because when I say that I'm a member of senior leadership, that's absolutely the case. But so to that point, I have a responsibility to the team that works for me. I have responsibility to my boss, who I report to, and to the boss that she reports to. I have responsibility to the healthcare system that we work for, and trying to juggle all those different poles can be difficult. But first and foremost, as a leader of an EMS organization, I have a responsibility to make sure that my team has the tools and the mindset to do the job that they're designed to do. And as a leader in an organization that is as diverse as mine is, I feel very fortunate that I can pull a lot of different levers to get the work done. It can be fun and interesting, but it can also be a challenge because sometimes the levers don't necessarily work. But I think as any leader in any organization, you have a responsibility to your staff to show that you have their best interest at heart. It goes back to Scott's point about engagement, engaging your team, understanding what their needs are. As you said, Jonathan, being in the suck with them to a certain degree. And although I spend a fair amount of time in my office, I do balance working the road when I need to or when I want to. Because in order for me to effectively lead my organization and inspire my team to want to give me 110%, even when they don't think they can, I have to know what's going on. I have to have my finger on the pulse. I have to understand the challenges. I have to be able to leverage my position within the larger organization to help make their work easier. And advocate where I can, stand up for them when I can, provide some course direction when it's needed. I feel like I'm in a group where there's not a lot of leaders that have that flex and that ability to pull different levers from all across different healthcare systems, to be able to give the team what they need so they can function effectively.
So I want to be mindful of your respective times because you guys are amazing and I'm so grateful to have you here. I want to pull out a couple. I want to sort of capstone some of this with some additional words pulling out of what your conversations have been, and bring it back around to the conversation about evidence and education. Because I mentioned I've got this nifty little, literally drawn on the back of the napkin. Can't really see it there. Nope, not do it. Nope. Zoom's not going to let me do it. It's an invisible flow diagram there. But one of the most, all of us on this call are students of leadership and organizational behavior. Whether it's running a service in medicine or in business, I don't think that, or law for that matter, HR, I don't think it makes a difference. There are clearly principles of leadership that one tries to internalize. One of the most important ones that I learned a couple years ago was around something called the invisible contract. And I've always tried to come back to this idea because it's one of those things where once you see it, you can't unsee it. And these are this concept of the assumptions that are made of understandings that we have of people that are never spoken, certainly never signed off. We have them in our relationships with our spouses and our kids. We have them with our coworkers. We have them with our charges. And so I find myself wondering, because tying into another piece of this and going back to the data and the charting and all that stuff is the punitive nature of things, the way that our industry runs by mandate in so many instances, right? I mean, talk about, you mentioned, Sean, about the systems that don't talk to one another. And while I don't really want to get into per se things like procurement reform, which we totally need in this country, the idea that, things that are put in place but don't talk to one another, often the answer is just do it, right? We got an instruction. We don't really know why we're doing it. There's a directive that came down from the feds to an organization, to a state, to a local, to a LEMSA in California, REMSCO in New York, in these regions, right? And we follow the instructions. And, it's Monday morning, so let's change those again. That kind of thing. To me, so much of that comes back to education. But it's not education per se. It's not in a classroom. A lot of it goes back to me to this concept of the invisible contract, right? Are we assuming, and by the way, if those aren't followed, then there is punishment, right? Whether it is actual punishment or perceived punishment, another invisible contract, right? How often have you guys heard in your work, if you don't document it, you didn't do it? Well, okay. So if I didn't do it, then now if I didn't put it in the box, now I might lose my livelihood, right? I always feel like I run a company that sometimes works in the EPCR space, which is the second most hated technology in the world after electronic health records, right? Nobody likes EPCRs, right? And I was trying to figure out why anybody cares about an EPCR to the point where they're this emotional to hate them, because it's a document. It shouldn't elicit passion in that way. And I realize it's because it gets bound up with the fear of losing your job and being able to feed your kids and continue to do your work, right? Or keep your organization open and working, right? And so if I didn't do it, then I don't get paid, or I get sued, or I get in trouble. No wonder people are afraid of this thing. It's got all kinds of baggage associated with it, right? So I find that goes back to this invisible contract. And when you talk about the levers that you pull and the time you spend in the field, which, by the way, I think makes each of you fantastic leaders at what you're doing. And Scott, obviously, you being in all these places, you have a privilege that I actually try to emulate. It's one reason why I travel as much as I do. I'm literally trying to emulate you. In fact, I talk sometimes to my kids this way, and I'm trying to emulate them too, and they wonder what the hell I'm doing. I mean, there was really, people used to say I have a face for a face for radio and a voice for print. I didn't know what they meant until I met you. Anyway, loved buddy. So the invisible contract, right? How much do your crews know what you do, right? I mean, do they know what it means to be a manager? Because you spend time with them, right? Learning what they're going through. But there's a lot of crap that comes at people in management. And I don't know that they appreciate it either. So this idea of like, well, the boss is telling me to do something. Maybe the boss is being told to do something. Maybe there's a reason. Maybe there's something we don't know. And I find that, again, when we think about this flow chart that I did, which is data to statistics, to education, to evidence, to, and we can talk more about this, but to investment, to less overtime, to better life. And I'll do that again, because I want to hopefully we write this down. So if you can go, I can see a line, data to learning how to do statistics, which comes from education, which allows you to demonstrate evidence, which generates investment, which results in more resources, which allows people to have a balanced life, which achieves the objectives that every single one of you has mentioned in different ways now, right? So ultimately, to me, data is a kernel, but it's a tool, right? It's not the be all and end all. It helps flow these things forward with the ability to say, are we achieving those metrics across ourselves, within our own KPIs, across our colleagues? But how much of this comes back to, and this is my kind of capstoning question for each of you, as the managers that you are and have been, have you found occasion to teach your personnel what it means to be you? right? So that instead of having the open door, going back to Scott, I think your analogy is wonderful. It's one thing to say, come into me when you have an issue. How often have you had a shadow, right? And someone understanding just how much shit is coming at your head. And so you've got spinning plates that they don't see. And if those are the invisible contract, at least in my view, if they knew, just like you try to breed empathy with them by going into the field, would they have empathy for what you're dealing with if they saw your moving parts and the gears that you have to balance? I think that would be, if I can get that from each of you, and you guys talk to each other, that I think would be hopefully a level of conversation that I have never heard happen in this industry, largely because of the silos, by the way, Scott. Right? When we talk about, nurses talk to nurses, firemen talk to firemen, and medics talk to medics, and docs talk to docs, and yada, yada, yada. But you've got management conferences, you've got management associations, you have organizations representing the folks on the ground. And as you mentioned, the first time that you can think of within the last few weeks that they've come together to say, what is each of us experiencing that we may have never said to the other for fear of blank? That's where I kind of want you guys to go. So talk to me about how we inform the folks that work with and for us about what it is that each of you does every day. What would you wish they knew that they don't?
Can I jump in real quick?
Please.
I don't want to jump ahead of Scott.
I'd like for all of you guys. This is for all of you guys.
When I first met Scott, him and I had some pretty in-depth discussions. I think it was at a AAA conference. He was still running an ambulance service at the time. And one of the things that he had said to me has resonated ever since. And he had talked about the question why and what he asks his team. He tries to understand what each individual player does. He wants the individual people in his organization to understand why they do what they do, how it impacts the organization. You can ask the 5, 6, 7 different whys to get to the root cause of stuff. And this is something you and I talked about the other night at dinner, Jonathan, is getting to the root cause of stuff. Whatever it is. Is it a policy violation? Is it a discipline action? Is it a treatment therapy? When talking about data,
get to the why we do what we do. And we can't get to that until we ask that question. But to answer your question directly, I have had these conversations with my team. I frequently offer them a seat behind my desk. They're more than welcome to take it for a day. Not once has anybody said, yes, please, can I do that? They typically run out of the door screaming. But I don't hide what my role is. I don't hide the stress that I'm under. I don't hide the challenges that we're facing. I'm brutally honest with the team. I have those difficult conversations.
But how rare are you?
It's tough.
How rare are you in that regard? Because again, the word stigma just popped into my mind. Right? As a manager, and you talk about your stress, how common is that? What has been the effect that others may look at you and say, wow, if he's telling them how much stress he's under, is that going to make me as a manager look weak? Or is that going to make me as a manager like someone you can relate to and therefore realize that a little empathy goes a long way on all sides? What do you think? And what do you hear from other people that you engage with in your various groups?
I think it depends upon the perspective of the person that's asking the question. Everybody has a different perspective, and you're going to have players that, will have a little bit of empathy and say, you know what, Sean's asking me to do this. There's a reason why he does things. He tells us the reasons why. He explains his rationale for these things, and that is understood and bought by a lot of individuals. You're always going to have the occasional person who's just, no matter what you say, what you do, how you put it, it's a problem. You spend 20%, 80% of your time dealing with 10, 20% of individuals, and the bulk of the time, the majority of the team understands that. I've been working hard over the past couple of years to kind of focus on that 20% that that 80% that I don't have to deal with on a regular basis, and focus on them and spend the bulk of my time on them. And the other ones that they don't want to be there, fine. You know what? It is what it is. But I want to make sure that my team knows that they have 100% support for me and my leadership team.
What has been the result, the dividend, if hopefully positive, but the result of one or another of allowing people to sit behind you at that desk? What did you find? You said there's some of them ran out, but did anyone not? And among the folks who didn't, what did it do?
They asked the question, what can they do to help change the system?
Okay.
They get engaged. They want to be part of the solution and offer suggestions on how to make work easier. I can't ask for anything better than that. Constructive criticism is fantastic until it stops becoming constructive.
I love it. Well, I think that's a wonderful capstone there. Art, I'm going to point to you only because I'm still afraid you're going to get called out at any moment here. Sean, that was truly wonderful. Thank you. Art, how would you take that?
So I think as an industry, we don't do a good job of telling our staff what's happening behind the scenes. I mean, I will spend, heck, if I have an employee who's the least bit interested in how the finances work, because I've been accused of being a numbers guy, we'll spend hours explaining to them how it works if they want to listen for that long. Because I think that, at the end of the day, the better understanding that each of our employees has about the entire aspects of our business, the better they are at what they do. As much as we would like to say that provider that's going out and caring for that cardiac arrest is a medical provider, there's a lot more to what they do than just, putting the IV and doing the intubation and defibrillating and transporting that patient. There's a whole side of the operation that's just as large that happens behind the scenes that we don't talk to them about as an industry. And that's very important. It's very important that they understand it. They don't have to, we're not looking to give them an MBA, and we're not looking to say that, you need to be able to make all the decisions. But I find that when they understand what's happening behind the scenes, they have a better understanding of what we're all doing and that we're all playing our own part in the system. And, if all they do is see somebody go in and the office door closes, and then at 4 o'clock, the office door opens and they leave, then they don't necessarily understand what goes on. And that's a big problem. I think, as an industry, without, because let's face it, some of these people are going to be our leaders of tomorrow. And, it goes back to what Scott mentioned at the beginning about, mentoring these people, that sometimes that's just, that few minutes, when they ask you a question of not only saying yes or no, but explaining why the answer is what it is, because there's a lot more that goes through our heads when we come up with that answer than just yes or no, or at least there should be. And we need to impart that process onto our staff so that they can start to make those decisions for themselves, but more importantly, so that they can carry that through as they progress up through the system.
So, Scott, I'm going to bring it to you in a minute for a circle, as you mentioned. We're going to start and end with you and give you the last word on this. But Art, I want to ask kind of a follow-up that I think you mentioned an MBA. And obviously, we've touched on education here today. The topics of degrees could be another several hours worth of debate in another forum. But I do think it's worth, one thing that I find very interesting is how confused people are about where raises come from, right? That raises don't come from degrees, raises come from scarcity effects, right? Basic supply side economics. Right? So to the degree that if you have a credential or anything else that makes you rarer, you can command more money for being rarer if that is a priority, right? And what I just heard you say is something that I actually kind of hope and pray could become a basis for giving people higher wages, which is to say, are you an interested person? Right? It's because if you are somebody who could be a future leader, isn't that, and as demonstrated, there's not about evidence, right, by being the person who supports the organization, who wants to learn the organization, who becomes a right hand, a left hand, whatever it is, right, kind of understands that and therefore makes themselves more valuable, isn't that sense of curiosity, for better and worse, because I think it's a loaded reality, but isn't that sense of curiosity itself scarce enough that if you had somebody come to you and say, I want to be a leader, I want to know all this, is that the kind of thing that they would then get rewarded? And there's a question for you, Art. So come off mute real quick. But is this something where you would look at this person and say, I may be incentivized to retain this person, right? I want to be incentivized to find a way to make sure that this person wants to stay, not only because they're interested and we do a good job, but economically, just like in a corporate organization, where if you find a superstar, you're going to possibly give them a raise or a bonus or something to keep them there. So is that something that ever goes through your mind, or could it? And could that form a more solid basis than this idea that we go on and we get an ephemeral degree, and why am I surprised that I didn't get a huge bump? But maybe if I didn't need a degree, but I was generally interested in learning the back end, I don't need an MBA to become extremely valuable. What do you think?
I think definitely we want them to be interested, and we want to incentivize that interest. But I think that's a twofold thing. We want to incentivize the interest, but we also want to encourage the interest. And I think there's two things there. One of them is the employee who comes in with a general interest and they want to know more, they want to be involved in the process. But there's also the employee that we can make interested in the process. And so I think there's two separate things. It's incumbent upon us to try to get employees who maybe don't have an interest to find out what that interest is. And can we encourage that interest, and can we use that interest to the betterment of the system? And that's a struggle. I think we all struggle with that. It's one thing for us to say it, it's another thing to put it into practice. And, it's something that, obviously takes some time in getting to know your staff. And, as much as I would like to say that, yeah, we do that, we don't do a phenomenal job. And I'll speak for myself at that, because, we do get bogged down in the day-to-day minutia of what we do. And we don't always have the time that we would like to put into encouraging that. But all of your employees have an interest, and whatever that interest might be, we need to find it, and we need to try to encourage that, because it has some impact on what we're going to do or where they can apply.
All right, so Scott, and now we've 360'd back to Newton. How do you like that? I swear this video podcast, again, for the benefit of Mr. Hoare, is not, in fact, a podcast. It is a vodcast.
Well, I want to make one comment on something that both Sean and Art said. So, and frankly, you talked about data stats, education, evidence, investment, resources, balanced life, and then, objectives. And one of the things that I've asked for a long time is, the whole process of bringing someone into EMS is largely a clinically based educational path. And so once they go through the certification test or the class, and they pass the class and they take the certification test, and often we put them through some sort of educational pre-hire process. And then we put them into orientation, where we spend like 90% of the time in orientation is tied to something clinical based. And I ask you sort of what percentage of the average EMS person's day is spent doing clinical medicine, and in what percentage of what impact does a field provider have on the overall financial health and sustainability of the organization. And so, my impression is, one, I know when I got into EMS, there was no articulated path from EMT to director of operations. And so this goes back to that issue about education. I was a 1-4 college dropout, but I was the director of operations of a service when I decided to go back to college. That was for me, not because I thought it was going to return a higher investment in EMS specifically. So I just think that, I mean, a couple of things that, were said, that we shouldn't be surprised that people have sort of no idea about what most of us do, and no idea about how or how EMS is financially supported, and what are those levers that get pulled to make a service survive, because, well, we haven't taught anybody any part of that. And I don't understand why that isn't core to what we teach folks in the onboarding process, right? So that they can understand. Number two, I got asked while I was in the AAA conference by an owner of a service to be his mentor. And that's something that, one, blew me away because it was totally unexpected. And of course I said, are you kidding? Yes. But number two, I often wonder why, as part of the onboarding process and through the development process, that we don't require that folks, that we try and find mentor-mentee relationships for them based upon where they are in their career. And then the last thing that I'll sort of say is, and I appreciate the fact that you've talked about Newton, but again, I want to make sure, as we said, and you were kind enough to say this
is not an advertisement.
I am never going to convince someone to use a tool that I think is going to fix their problem, because what we've known for years and years is that when doctors give patients advice to do things that will fix their underlying problems or prevent them from having problems, that we know historically that doesn't change the problem. I can't convince owners and leaders of EMS agencies, it's the tool is not going, Newton 360 will not correct your problem. You, as an organization, are the only people who can correct the problem. Employment relationships are like any other relationship. So just consider how often you interact with your staff. Would you tolerate that level of engagement by your spouse or by your friends, right? And number two, when you think about those lifelong friends who you can pick up the phone after 10 years and go, hey, Jonathan, often you and I will talk once every year and we have it's like nothing ever happened. There was a lot that went into developing that before we got to that stage. So don't think you're going to have that. Would you tolerate a dog that came home once a year? You definitely wouldn't. So this comes back to, you get what you invest. I sort of say about labor, every management team gets the union they deserve. Right? Why? Because at the end of the day, if employees invest in the underlying leader and in the underlying core mission, and by the way, it becomes far more stickier when they understand the why. And again, what we do is intrinsically valuable. You have to go one further than that, because guess what? What your competitor does is intrinsically valuable. What hospitals do is intrinsically valuable. What fire departments do, or whoever it is intrinsically valuable. What makes your place the place that people want to stay, develop, and invest in? And that, to me, is the answer. And that's where this problem gets corrected.
And because I want to make sure, although that's a wonderful place to end, I'm not going to there. I want to just ask you a follow-on. Especially when all three of you have been talking about relationship and the importance of building that for every piece of this, right? Whether it's the education, the evidence, the clinical practice, the trust. Again, the conversation I'm giving next week is called "This is how we share a foxhole" at the Kansas City conference about post-traumatic stress. I mean, that battle buddy sensation is earned, right? It doesn't just happen. Do you find, and this can be for any of you, Scott, I'm looking at you, but this for either of you guys or any of you guys. Do the folks who work in your organizations want to provide that information, right? Because even though you may be inviting them to do so, again, invisible contract, is there a fear that if I tell you what I really wish I was doing right now is flying kites with my kid, there may very well be a say, well, if I say that, then I'm not focused on the task. Or it turns out I really want to be here because I'm fascinated by trauma, right? I mean, it's fascinating, right? Would people look at that and judge it? right? Say, well, that's a little kooky. So, to the degree that, and again, I'm not suggesting that either of these is right or wrong, but do you find that even if you are an open leader who asks that, do the folks who are there trust that you will listen to it and use it not against them, but in their interest, in the collective interest, to drive those bonds?
So,
and if they don't, how do we get there?
Yeah, and I'll just, because we all get paid, lawyers get paid by the word, right? So we can never shut us the hell up. What I'll say is this: think about all the decent relationships you've developed in your lifetime, and think about how often you felt, or what is it that makes you feel comfortable telling that trusted person something. And then once you think about that, because again, work relationships are just like friendships and marriages and every other relationship you're going to have. And there are some times, and there's actually been a lot of studies on this, that you find people you know forever and you don't trust them. And there are other people you may meet, and within a split second, there's something that makes you share a detail with them. In fact, the closing keynote was this thing called, what was it called? It was about basically sharing your secret anonymously, and how it's sort of releasing. I think, imagine now if you can share your secret to someone who you know, because you trust that they're in good hands. And I think, again, this comes back to wow, that was awesome. That was probably
impressive.
some 85-year-old lady in her Buick, but in any event, so if it was, I totally rock on. So what I would say is, I think this isn't something you can cheat. You're not going to suddenly scratch a lottery ticket and win the personnel relationship trust lottery. This is something that takes a deliberate, just like the diversity issue that you brought up earlier. That stuff's not going to happen by accident. It has to be intentional.
Well, between that and the horn, I think that is the best place I can think to end. The amount of wisdom among you. What? The amount of wisdom here. I mean, that's like if you were trying to find a way to subtly tell us that we needed to end, that was it.